I'd like to introduce Dr. Laurie Marzel from the United States, who prescribes LDN. Thank you for joining me, Laurie.
It's a pleasure to.
Could you tell us when you first heard about LDN?
I first heard about it maybe 5 years ago, something like that, when I was aware of using it for cancer cases, and I found it very interesting, although I didn't start using it at that time because I don't treat a lot of cancer.
Mm-hmm. So, when did you start prescribing it?
I started using it for arthritis, and especially autoimmune rheumatoid arthritis, things like that, maybe 4 years ago or so, and I found it was good, but when I really started using it again was when I had a personal case, a friend and a former patient who developed cancer, and I sent her to a variety of doctors that I thought would be good and would be absolutely at the best of prescribing any type of treatment that would, any kind of alternative treatment that would be beneficial for her. And they weren't prescribing this because I talked to one of the doctors and they were afraid of the institution they were working under the umbrella of didn't recommend this treatment, and I couldn't believe it. So I started prescribing it myself. Within a very, very short period of time, a few days, this patient, who was supposed to deteriorate and die within a few weeks, developed more energy, better mood, and lived about 6 or 7 months instead of just a few weeks to a month.
Mm-hmm.
So I was very, very impressed with the almost immediate effects that it had on this patient. She had less pain. She did not require the type of pain medication that everyone else expected of her. And she was able to live long enough and in a more comfortable way to say goodbye to her family and to not suffer to the extent that everyone else expected her to have to go through. I was very impressed with this.
Mm-hmm. And have you prescribed it for any other conditions since then?
Then, when I saw this case, I reviewed the immunology of using this drug in a small dose, and I reviewed the work of several of the doctors that have used it and published, and I attended the conference last year, and I started using it for almost everything.
Mm-hmm.
I now use it if there's an autoimmune component. I think of this drug and I use it, and I have great results. If there's an inflammatory problem, I use it. If there's pain, I would rather use this than all the more severe side effects that patients could develop from pain medication. And I'm also really impressed using this for mood disorders when someone is depressed or anxious. And I wanted to mention a case that was one of my favorite cases that I would like to talk about. And this is a woman who had a very aggressive form of breast cancer. It was treated, but she was unable to take hormone replacement therapy, one of the few cases that I really could not at this time bring hormone replacement on board with. She was anxious, depressed, and extremely negative, and her whole family was, she was miserable herself, and her family was miserable. And I was impressed by the concept that one of the doctors brought to me that I spoke to about this, that it could be used to not only treat cancer, but to prevent cancer. And I thought this drug would not only stimulate the body to produce hormones that would prevent cancer, but also treat her anxiety and depression. So I said, let's try it and see what happens. Within a few weeks, her daughter reported back to me and said, I have noticed a difference in my mother's attitude. And she said, thank you, I have my mom back. Oh. And that really touched me. Mm. And she's using that to this day, and every time I talk to the family members, they say she is better. Her mood is better. So that was a very rewarding case. I've also used it quite a bit for fibromyalgia, and I've been absolutely, I think the results are just almost unbelievable. I've had patients that I've worked with in food allergies and a variety of alternative therapies, and they just weren't working up to the level where the patient was receiving relief. And I had one patient who was just chronic fibromyalgia, complaining, crying, taking very heavy doses of pain medication. And I said, if you're willing to cut this out, we could try low-dose naltrexone. And I explained to her how it would work. Within a few days, honestly, within a few days, she called me up crying and thanking me that she'd finally found something that had given her pain relief, and the pain was gone. And I've used it on several other cases of fibromyalgia since then with excellent results.
It's so thrilling to hear all these stories. It really is, and doctors do enjoy prescribing LDN, like yourself saying every time somebody comes in that you're looking for an autoimmune component or pain. I mean, it just has so many uses, doesn't it?
Mm-hmm.
So have you noticed any adverse effect, any side effects that aren't very good with any of your patients?
When I prescribe this, I always tell patients that it may wake them up at night. It may make them jittery, and they should watch out for that, and they might have strange dreams. But I have noticed with a few patients that sometimes when they first start it may make them so jittery that they do get a little anxious when they wake up. And sometimes that goes away, and sometimes they have to have it during the day instead of before they go to bed at night. I did notice one or two patients, I think, developed a little bit of high blood pressure. So I brought on board some treatment for that and decreased the dose. And some patients really, I've had a few that were very, very sensitive, and I had to really make the dose very smaller than the recommended amount, but not many. Mm-hmm. Most patients do well and adjust to it, and they say, oh, I don't care if I have some strange dreams. So what? I'm pain-free. I feel good. I have energy. And so most adjust well.
Mm-hmm. Is there anything else you'd like to add?
Well, let me just make a statement about using it with arthritis, because mm-hmm. I've been so impressed with using it for this purpose. I had a case that had psoriatic arthritis, just started developing, and psoriasis is an autoimmune disorder. So I started the patient on medication. She was also consulting with a rheumatologist at the same time. And the rheumatologist said immediately that he wanted to go in and inject the joint with a steroid. And she said, well, let me try this first and give me about 2 months. And if it's not working, let's do it. She was very active and was afraid that it was in her foot. And she was afraid that with a deformed joint that would inhibit her activity. So she tried the naltrexone. It worked. The pain went down within a week. Within a few days, she noticed the pain in the joint was diminished, and it recurred a little bit, but then it kept diminishing as she continued the dose. And when she went in to see the rheumatologist to decide if further aggressive therapy needed to be done, the pain had almost totally resolved, and there was no joint deformity. And when he examined the rheumatologist examined the joint, he said, I don't think it's worth injecting this joint. It seems to be, doing pretty good.
Wow.
Because it's not worth doing. And I had another patient that had and I didn't expect it to work with this particular patient, who had osteoarthritis. And I thought, well, that's not really an autoimmune disorder. It doesn't fit the immune criteria for this drug to work this way. And I said, well, I tried everything else, and it wasn't working, and it was a particularly severe type of osteoarthritis where he was getting deformity of the joints. And I sent him to a rheumatologist because I just wanted to make sure that the joints were becoming so deformed. I wanted to make sure I wasn't dealing with an autoimmune or an inflammatory type of arthritis. And he said, no, this was just a type of osteoarthritis that was going awry, and that the patient would have to start taking high-dose, non-steroidal, anti-inflammatory drugs right away. This is the only thing to do for it. And I had started the patient just before he was seen by the rheumatologist on naltrexone. And the patient reported, yeah, the pain seems to be going away. It's pretty much gone as long as I take this.
Oh, wow.
So the patient went back to see his rheumatologist after being diagnosed and continuing to work with the naltrexone. And the rheumatologist said, yep, you've got to just keep on and take all these heavy-duty drugs, which could have hurt his stomach and caused ulcers and that. And he said, I've been taking naltrexone. Are you familiar with it? And he goes, yeah, I guess you can take that if you want, and blah, blah, blah. But you really have to take these or the joints are going to continue to be inflamed. He goes, well, I'll tell you, I seem to be doing real well with taking this naltrexone, and I think I'm just going to keep taking it.
Wow. I've not heard that before. That's really good.
Yes. So I thought there's a whole different area that I didn't really expect it to work in. Mm-hmm. And I tell my patients something I think is really important in using this type of therapy, because I'm a naturopathic physician and my patients want just to enhance their body. They don't want to take a drug to do something. I tell them the drug isn't doing this. It is your own body. It's the endorphins and metencathlons that are being stimulated by your own body that is doing the work. It's not the drug. The drug is just stimulating that from your body. Mm-hmm. So that makes a difference to them, I think.
Exactly. I mean, so many people just do not want to take any toxic drugs, do they, that could potentially have awful side effects. Well,
I am pretty darn impressed with this therapy.
Thank you very much, Laurie, for sharing your experience with us.
Thank you for being a voice in this field, which is so desperately needed.